Hi, I'm Michael and this is California, and today we're back on track with a healthcare video. So today we're going to talk about Medicare and one of the biggest questions we get from the folks coming into our office on a day-to-day basis, and that is who's eligible for Medicare and when can you get it? So today we're going to talk about who's eligible for Medicare and when you can apply, as well as for those folks who may actually have to actively apply versus those folks who are automatically going to be enrolled. Now, before we do that, we here at California, we know health insurance. So whether it's a Medicare health plan or a Medi-Cal plan or Medicaid or Medi-Cal or private health insurance or even Covered California for those folks who are not eligible for Medicare, we can help you look at all those different options. And if you have any comments or questions, please leave them down below. We love your comments and questions, and that way we can make a new video or a new post to go over those comments and questions as soon as we can. Also, if you like this video, if you find it interesting, you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. All right, so let's first talk about what is Medicare. So Medicare is a federal program. It's a health insurance for folks who are disabled and folks who are retired. And it's made up of mainly two parts, Part A and Part B, which is called Original Medicare. So when you get that red, white, and blue Medicare card, it's going to say on there Part A and Part B. Now, Part A is for hospitalization. So that's like big stuff. You spend that in the hospital, things like that, are going to be covered under Part A. Part B is really your normal day-to-day stuff like doctor's visits, specialist visits, lab tests, x-rays, things like that are covered under Part B. Now, what I didn't say is things like medications, because medications are actually not covered under Part A or Part B. Additionally, Original Medicare does not cover 100% of your costs, as well as it doesn't have a comprehensive dental, vision, or hearing coverage associated with it. Now, another thing that's really confusing is some folks think that Medicare and Medicaid are the same program. They can be pretty easily confused because they sound similar. But they're actually two separate programs. And we're not going to talk too much about Medicaid or Medi-Cal here in California right now because that is a whole nother can of worms. But we will make a new video for that in the near future. But for the time being, just need to know that Medicare is a federal program. It's health insurance to help folks who are retired and who are disabled. All right, so let's talk about who is eligible for Medicare. Now, the vast majority of folks who are going to be enrolling in Medicare are getting eligibility based off their age. So they're 65 years old, they've worked in the United States and paid into Medicare for 10 years or 40 quarters, and they're either U.S. citizens or legal residents. So undocumented folks, unfortunately, they're not able to apply, whether they are have paid in enough time or they're 65, doesn't matter, they won't be eligible to apply for Medicare. So, but the majority of folks, 65 years old, they paid into it, and are legal residents and citizens, they're going to get a red, white, and blue card 3 months before their birthday for Medicare. So they're going to get enrolled automatically based off those criteria. Additionally, those folks who didn't work can still apply as well and still may be eligible. So for example, my grandma, she stayed home and took care of the kids, and my grandfather went out and worked. And in that situation, if that's a similar situation, she's actually eligible for Medicare based off the years that my grandfather worked. So even though she didn't actually work at all, she can qualify based off the years for my grandfather. Now, some other things to Medicare is that it's different ages from Social Security. So you can apply early for Social Security at 62 or even wait all the way up until 70. But for Medicare, the golden number is 65. That is the time you are going to want to apply, unless there's a couple other stipulations where you don't need to apply till later. Now, some other things about Medicare is that there is a cost to it. Like I said, it's not free. So Part B actually has a cost of $144 a month. Now, for the other folks who are eligible, those are usually folks who are disabled. So if you have been disabled for 24 months or more, then you also may be eligible for Medicare as well. All right, so finally, let's talk about when you can actually get enrolled into Medicare. And again, for the vast majority of folks, they're going to get automatically enrolled once they turn 65. They're just going to get that red, white, and blue card from Medicare. Going to say, welcome to Medicare. Congratulations, and your Medicare is going to start on your birthday. But you actually have a 7-month window to apply. So you can do 3 months before your birthday, the month of your birthday, and then 3 more months after to still apply, just in case it doesn't happen right when you turn 65. Now, also for folks who are not taking Social Security and who are not retiring, they may not actually get enrolled into Medicare automatically. It doesn't always happen automatically. But if they want to apply, you can still do it manually. You can go in person and do it at your Social Security office, or you can do it online. And I'll put the link down below for folks who want to apply online. Now, also for folks who are disabled, they should get their card 3 months before their 24th month of disability. If that doesn't happen, and again, it doesn't always happen, you can still apply manually in person or online through the link. For those folks who missed that initial enrollment period, they will have to wait until the open enrollment period or the general election period, which is during January, February, and March of every year. And that's a time frame when folks who didn't have any other reason to apply throughout the year can jump into it without having any reason to apply for Medicare. And when they do that in those months, January, February, March, then the Medicare plan will actually start in July of that same year. Thank you so much for watching our video, and I hope that you found it interesting or useful, or at least helpful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions about your Medicare, leave them down below. We love to see your comments and questions. We'll be happy to make a new video or a new post to answer them as soon as we can. So other than that, I'm Michael, and this is California, wishing you a happy, healthy day.